Hi, my name is Jenniffer Caragan, and this is my SystemsVideo1 for health assessment. In this video, I assess my patient's head, eyes, ears, nose, and throat, cardiovascular and respiratory systems. And I just wanted to say before showing you the video that uh, with respect to my patient, I understand that auscultation is to be performed underneath the shirt, but I didn't want to expose her for a YouTube video, so I just auscultated above the clothing. Thank you. I'm just going to wash my hands before I talk to my patient. I'm Jenniffer. I'm going to be your nurse today. I'm just going to take a look at, do an assessment of your head, eyes, ears, nose, and throat, and your heart and lungs. So I'm going to start off first by looking at your head. It's normocephalic in shape, atraumatic, symmetrical. The color is appropriate for ethnicity. It's moist and the texture is smooth, and the skin turgor is good. There's no tenting in the skin, and there's no moles, lesions, masses, scars on the face, and the earlobes are pierced bilaterally. There's no scars, no tattoos. The fingernails are good. They're no clubbing noted. Their cap refill is less than 3 seconds. And now I'm just going to take a look at your scalp. Your hair is good normal distribution. There's no masses palpated or any no scars noted either. And then for your TMJ, I'm just going to have you open your mouth when I palpate right here. Open your mouth wide, and then move your jaw side to side. Okay. Normal movement, range of motion noted. No crepitus. And now I'm just going to palpate your temporal arteries and your carotid arteries. And I don't see for sure temporal arteries and your carotid arteries feel normal. Now I'm just gonna auscultate your temporal and carotid arteries to assess for bruits. So I'm gonna put on my stethoscope and listen to this temporal artery first. No bruits there. Now to the left side. No bruits there. And left carotid artery. No bruits there. Sorry. And sorry. The right carotid artery. No bruits there. Okay. Now I'm just going to take a look at your eyes. Your upper eyelids and lower eyelids are intact. No abnormalities noted. The conjunctiva is clear on both eyes, and the sclera is white on both eyes. Outside and inside sclera is white. The lacrimal ducts are clear and normal. No exudate noted. Normal moisture. And so now I'm just going to take a look at your pupils. They're about 3 millimeters in size bilaterally, and they're round, symmetrical. And I'm just going to shine a light into each of your eyes to test for pupillary reflex or reaction to light. First I'm going to shine a light into your left eye to test for a direct reaction to light and consensual. And that was normal. And then direct and consensual reaction to light is normal as well. And then now I'm just going to dim the lights and use my ophthalmoscope to take a look at your eyes and check for, I'm going to first look into your eye over here, so focus on a spot far away, and I'm just going to take a look and see that your red reflex is normal, your retina and your macula are intact, no hemorrhage noted, no papilledema, and no exudates noted as well in this eye. And then for the right eye, the left eye, the red reflex is normal, the retina and optic disc and macula are all intact, no hemorrhages, no exudates, no papilledema noted as well. Your right ear, the auricle and the pinna and the earlobes and the tragus are intact. I'm going to use my otoscope to take a look inside at your tympanic membrane. So I'm just going to pull your ear back like this and take a look in. And your ear canal is intact, the tympanic membrane is intact, it's pearly gray in appearance, and light reflex and mobility are normal. And then on the other side, and then I'm just gonna, put your hair back, and pull your ear back and take a look inside. Your ear canal is intact and clear, your tympanic membrane's clear. It's got normal light reflex and normal mobility, and no exudates noted. So now I'm just going to take a look at your nose. It's symmetrical and it's intact. There's no deviation noted from the outside, and it's central on the face. I'm just going to test your patency of your nostrils. So I'm going to have you blow air out of your left nostril by holding down your right nostril like this first. Okay, go ahead. Sorry, and then do it on the other side. Okay, so nares are patent bilaterally, and I'm just gonna take a look inside first on this side to look at the nasal turbinates. Can you just tilt your head back for me a little bit? Thank you. And then, so I'm just gonna look and see your nasal mucosa and your turbinates are normal, pink and moist. No exudate noted on that side. And then on this side as well, the turbinates and oral mucosa are pink and moist, no exudate noted, and no deviation in the septum noted. Now I'm just going to take a look at your mouth and your throat. First I'm going to take a look at your lips. They're intact, no scars, ulcerations noted, and they're pink and moist, which reflects adequate hydration. I'm just going to have you open your mouth so I can take a look inside and take a look at your your teeth, and your throat. Your buccal mucosa are pink and moist on both sides. The hard palate is also pink and moist, no cleft palate noted, it's intact, and the same for the soft palate. Dentition appears to be normal, no missing teeth anywhere. The tongue is pink and moist, normal papilla. And now I'm just going to use a tongue blade. I'm going to have you stick your tongue out and say ah, and I'll just put a tongue blade to push down your tongue, okay? Thank you. The uvula is midline and moves up medially when the patient phonates, as well as the tonsils, they move medially. Both tonsils are about +1 in size, no white patches noted, no exudate noted. The soft palate is pink and moist and intact, and the pharynx is also white. I'm sorry, the pharynx is soft and or pink and moist. And now I'm just gonna have you stick your tongue out, and then I'm gonna move it to the side to check and see. So keep your sticking your tongue out. I'm just gonna move it to the side to look for any fissures. So none on that side, none on this side. I'm just gonna move it up and look at your frenulum, and the frenulum is intact inside. Sorry. Okay. Your neck has good range of motion. So if you could move your head forward for me, tilt your head back, turn your head to the left, and then to the right, and then rotate your head circularly at the front. That's good. Good cervical range of motion. Okay. So now I'm just going to assess for tracheal deviation by looking at the front and checking midline. The trachea is midline, no deviation noted. And then I'm just going to have, I'm going to palpate your thyroid. So I'm going to have you drink a sip of water. I'm just going to check and see if there's any nodes or masses here. So go ahead and take a sip for me and swallow. Okay. So thyroid feels good, no masses palpable. And now I'm just gonna check your lymph nodes for any swelling. I'm just gonna feel behind the occipital. Oh, sorry. I don't feel any swelling. A little bit of tenderness noted on the right side. No swelling here. Okay. No swelling in any of the lymph nodes throughout the neck and the clavicular region. So now I'm just going to take a listen to your heart sounds. First, I'm going to listen to the aortic valve at the second intercostal space on the right sternal border. And then on the pulmonic valve. Ribs point. And then the tricuspid. And the mitral valve. Okay, it's good. S1 and S2 sounds noted. And now I'm just going to listen for any bruits in all of the points as well, starting at the aortic. Pulmonic. Ribs point. Tricuspid. And then at the mitral. Okay, no bruits noted in any of the 5 parts of the heart. Now I'm just gonna inspect your chest and your lungs. There's no pectus excavatum or carinatum noted in the chest. Chest is normal. Symmetric chest expansion is symmetrical. And the anterior posterior diameter is less than the lateral diameter. And then now I'm just going to take a listen to your lung sounds. I'm just going to have you take a deep breath whenever I move my stethoscope. So go ahead and have it take a deep breath for me. Just listen to your lungs over here. Listen to your lung sounds in the back. Deep breath. Okay. I'm just going to check for tactile primitus now. I'm just going to go to the front, and I'm going to have you say 99 everywhere I press my hand. Sorry. I'm just going to put
99.
my... Okay.
99. 99. 99. 99. 99.
Okay. Now we'll just go to your back. Okay, say
99. 99. 99. 99. 99.
Okay. No tactile primitus noted. I'm just going to percuss your lungs as well to check it for resonance through the lung fields, starting at the apices. Sorry. I'm just going to percuss at the front. After auscultation and percussion of all lung fields, the lungs were cleared to auscultation throughout bilaterally, and percussion of all lung fields showed no consolidation bilaterally. Okay, so now I'm just going to check for the pulses. First, I'm going to assess for her radial pulse. The left radial is +2 in strength, and the right radial is +2 in strength. And they're equal bilaterally. And then I'm going to check for the popliteal pulses. First, I'm going to check the left side. That one's +2 in strength. And then on the right, that's +2 in strength as well. They're equal bilaterally. And then I'm going to assess for the dorsalis pedis and posterior tibialis pulses. First, the DP pulses are that one's about +2 in strength on the left side, and then +2 in strength on the right side as well. They're equal bilaterally, and the posterior tibialis pulse is +2 in